Hello, my name is Eileen Villa, and I will be talking about depression, something that many people struggle with and struggle to seek help for. What exactly causes depression? Depression is the feeling of severe despondency and dejection, which is also known to be the leading cause of suicide. Some causes of depression are traumatic events, genetics, brain chemistry, certain medical conditions, substance use, stress, and poor nutrition, or no particular reason. These questions lead researchers to believe that if a person has a small amount of neurotransmitters, which is a chemical substance that is released at the end of a nerve fiber by the arrival of a nerve impulse and by diffusing across the symphysis or junction, then it could be the reason as to why some people have depression. This is where certain medications are prescribed to patients in order to better help the effects of depression. Even then, depression is a highly complex condition that cannot easily be resolved. Treating depression. Some ways in treating depression can be through medication and therapy. The first suggestion from psychologists is usually therapy, but for some people this can be a challenging process. These obstacles can be through payment methods or the person itself who seems to not get any help from the treatment. When situations like this occur, medication comes into play. Medications like SSRI, SNRI, NDRI, and other antidepressants are designed to perform certain functions on patients who can no longer seek help from their therapist. I'll give a brief explanation on these medications. SSRI is the most common type of prescription and affects serotonin in the brain. SNRI is also commonly used and is also used for anxiety. NDRI is used for depression and is sometimes used to treat anxiety. Besides medication, therapy is also a helpful resource when combating against depression. Some of the ways that therapy can help is by stepping back and seeing the bigger picture in life. By this I mean it helps you view your relationships, overall health, physical and mental, and environment. Many therapists give their patients a list of coping skills in which patients can use when they feel at risk of hurting themselves or others. Some of these coping skills include scribbling or doodling on paper, drawing tattoos on themselves, playing a musical instrument, exercising, singing, reading a book, taking a shower, baking, and so on. Usually when people think of therapy, they think of individual therapy. However, there are many types of therapy used for depression. For example, psychotherapy, the treatment of mental disorders by psychological rather than medical means. CBT behavioral therapy, a form of psychological treatment that has been demonstrated to be effective for a range of problems including depression. Family or couples therapy, a type of psychotherapy that focuses on improving your communication and conflict resolution skills, or even group therapy, which helps individuals develop communication skills and socialization skills, and allows clients to learn how to express their issues and accept criticism for others. Overall, therapy can help behavior patterns that may contribute to your symptoms, communication skills, and socialization skills. Depression symptoms. Since depression is a brain-based disorder, there are many emotional symptoms that come along with it. Examples of these symptoms are feeling sad or empty, feeling hopeless or helpless, feeling worthless, no pleasure in activities, anger or irritability, insomnia or lack of sleep, poor memory or concentration, lack of appetite, aches and pains, and thoughts of death or suicide. How common is depression? With all this information, you might be wondering how many people actually have depression. Most common patients with depression are around the ages of 12 to 59 years old. Over 25% of patients admitted to a hospital due to depression are diagnosed with psychotic depression, and 10 to 15% of women develop a major postpartum depression. 11.3% of adults who report 2 or more races have experienced a major depressive episode in the past year. 8.7 of the women have depression, and 5.3 of men have depression. Inspiring stories. Since depression is a common mental disorder, many people have chosen to speak about their own experiences with the disorder. Helen Fisher, a motivational speaker, showed audiences MRI imagery to show how the human brain is physically impacted by heartache, whether it be from a love loss or entering a new relationship. She even compares the dynamics with drug and alcohol abuse. She explains that it is all about brain chemistry, which is why she uses such imagery. Another motivational speaker is Dan Gilbert, a man who talks about how depression cannot be expected to suddenly vanish. He explains that people need to motivate themselves and combat against the disorder by looking at it in a positive aspect. He states, "We can't all win the lottery, but we can work to improve our demeanor to the point where we feel like $1,000,000. How to fight depression naturally. There are ways to treat depression naturally. However, this does not mean that these remedies can be used as a permanent solution. If you do have serious mental issues, then consider talking to your doctor. These remedies can be temporary solutions, such as realizing that you are not alone. Millions of people suffer from depression, and it's something that many people tend to forget since they feel isolated. Knowing that you are not alone can help you seek or even understand the disorder itself. Another way people tend to fight depression is through hiding their emotions. This remedy is obviously unhealthy and can be used as a defense mechanism. However, allowing yourself to feel these emotions can lead to healthier outcomes. A healthy method is journaling, something many therapists and psychologists recommend doing on a daily basis. Realizing that a bad day does not lead to another is also something to think about. Depression can make you feel as if any horrible situation can only lead to the next. However, a new day can always bring a fresh start, not a continuation of another. Also, realizing the good that comes out of a day can be a way to balance a day. While there are many negative outcomes that can come out of a day, there are also plenty of positive outcomes that can come out of a day. You'll realize sooner or later that everything happens for a reason, and it's okay not to know the reason why. Many people with depression also tend to listen to their head, to what their head is telling them. By this, I mean they tend to believe all negative thoughts that they are telling themselves. However, you need to think logically. If you learn to address each thought, then you might end up creating a habit of it. As hard as it can be to get out of bed when you have depression, you need to realize that at the end of the day, you did. Reward your efforts and compliment yourself when you do so. Realizing small goals such as eating a healthy meal or even taking a bath can be used as an example of rewardance. What you can do to help others. After listening to all the thoughts a depressed person has, you might be wondering who you can help. Even if you think it is too late to help someone, it never is. If you or someone you know has experienced any of these symptoms, please seek help. Bottling up every problem will never help the situation. It will only make it worse. It can be terrifying confronting the situation, but in the end you will thank yourself for your efforts. Suicide is never the answer. Even though it seems as though this can leave all your problems, it'll only create more for others. Please note that depressed people convince themselves that they aren't worth anything and tend to compare themselves to others. Remind your loved ones that it is not true. Be kind to each other, including yourself, and always treat others with respect. You can never truly know what others are going through. Being kind to someone has never had a negative outcome, so never hesitate to express it. Even complimenting someone can brighten their day. Always try to set an example to others of how you should treat each other, and if you are personally struggling with depression, don't be afraid to admit it. Talk about it with a loved one and know that things will get better no matter how much you doubt yourself. My personal experiences with depression. I chose this topic of depression because it is an illness that I have struggled with since I was about 11 years old. I was bullied for my looks and who I surrounded myself with. At such a young age, I accepted every negative comment that people made against me. At around 12 years old, I started to experience more symptoms of depression. I noticed how bad it was getting, but only kept it to myself. It wasn't until my mom started noticing my symptoms that I started seeking help from others. She asked me why I had been acting the way I was for so long. As hard as it was to explain the situation, I finally opened up to her about what I had been experiencing. I moved schools and found people who accepted me. I still struggled with depression, but sought help when I needed it most. From time to time, I would keep my struggles to myself until my thoughts had gone too far. I started creating unhealthy habits, such as sleeping too much and eating too much or too little. As much as I convinced myself that I could get through it on my own, I realized that I needed professional help. I've finally managed to find help and realized how far I've come. I knew from the moment I sought help that this would be a new start for myself. I realized that life is too short to leave behind, and that I needed to fight against what was harming me for so long. I changed my mindset and goals for the better, and I want you to know that you can do the same. Remember, sometimes we're tested not to show our weakness, but to discover our strengths. And this concludes my presentation on depression.